Good evening and welcome to Arizona Horizon. I'm Ted Simons. Reports suggest that you can expect to pay more for health coverage next year, and that's regardless of whether you get your health insurance from an employer or through a healthcare exchange. And to learn more about all this, we welcome Dr. Swapna Reddy. She's from ASU's College of Health Solutions. Swapna, always good to see you. Thanks for joining us. We're always talking about tough things.
We certainly are.
And we're talking about tough things again here. Health insurance premiums expected to rise like for everyone next year?
Well, most of us are going to see a significant increase in how much we pay for health insurance next year. So this is going to absolutely affect folks that receive health insurance through their employer, which, by the way, is most of us, about 53% of the whole population, 63% of working age folks, and also those that rely on the ACA marketplace for their health insurance.
And I want to get to the ACA marketplace in a second because that's the reason that the government is shut down, basically. But a 9% increase on average, that's like the highest in a decade.
That's absolutely correct. So we're expecting about a 9% increase nationally on average, the highest in about a decade. And there's not really a consistency in what those increases are going to look like because obviously the insurers contract with employers, right, to determine what those rates will look like. But we're definitely expecting a significant change in how much people are going to be paying for those premiums coming up.
And so why is this happening?
Well, a couple of reasons, and we have to go by what the insurers are saying, right? So they're definitely saying that there are higher costs, just kind of higher costs of care. Hospital stays are more expensive. Doctor's visits are more expensive. Drug prices are more expensive, especially for specialty drugs, and also higher use of things like GLP-1s. And they've also mentioned the impact of tariffs on healthcare as well.
So they're factoring in tariffs already, huh?
They sure are.
How is that factored in? Is that just supply chain? Is that some of these drugs?
Yeah, absolutely, as it relates to prescription drugs, as it relates to devices, as it relates to importing all kinds of sort of instruments, all kinds of drugs and devices that we actually probably don't think a whole lot about that we use every single day in the healthcare system.
All right, I want to get back to higher labor costs for healthcare workers and how much that factors into this. Is that something that has been gradually increasing, or is that something that we're seeing a spike in?
Definitely gradually increasing, but we are absolutely seeing a high spike. I mean, we have an aging population that has higher health cost needs, right? So we definitely see the impact of that, but we're also seeing shortages in the healthcare workforce, since we have to make up for those shortages, often with having to pay folks higher to also stay in their positions.
So that's the labor costs. And as far as charges from hospitals and from doctors and providers, again, is that something that it looks like it's going to do this, or has it been gradually increasing?
Well, it's gradually been increasing, but they are attributing much of that to healthcare inflation, and the rise of inflation as it relates to everything certainly is not skipping healthcare either.
And more demand for care because of the aging population, as you talked about.
Yes.
The costly new drugs, Ozempic, was that one of the things that we're talking about
Yeah,
here?
we're definitely talking about GLP-1 drugs, right, to treat diabetes, but also as a really effective tool for weight loss and a higher need, demand, and lots of great evidence on the wonderful effects of GLP-1s, and so more folks want it. The prices are still quite high, and so again, that's going to affect the cost and how it gets passed down to the consumers as well.
Now, I would imagine a larger employer might be able to maybe modify or mitigate a little bit more than a smaller employer. What do you think?
Yeah, so here's what we're going to see. We're going to see probably about 4 different approaches to these rises in premium. So some employers might just eat the costs, right? They might just absorb the costs. And who are the folks that would be most likely to do that? Really large employers, and also employers that have kind of specific labor needs, right? And so they can't really afford to lose their employees. Number 2, we might actually see those costs transferred to the employee via higher premiums. Number 3, premiums might not actually change that much, but our deductibles might go up. And number 4, we might see more narrow networks. That's really what we're expecting, one of those 4.
Okay, if we see one of those 4, when will we likely to see it? Relatively soon at the start of the year? Or is this, again, going to be something that's a little frog in the water kind of thing?
Yeah, well, most of us are going to be entering in our enrollment period, right? Right in the fall, and we usually start our new plans in January. So if there's an increase in those premiums, if there's an increase in those deductibles, expect to see those real soon, and especially if you or someone in your family utilizes health care.
All right, let's get to the Affordable Care Act here, and the reason they're shut down in Washington. As far as the expansion expanded tax credits are concerned. I mean, if that doesn't happen, if those things don't continue, what kind of increase are these folks going to see?
Right. So really important to note, this is an enhanced tax credit that the public was given that uses the ACA marketplace in 2021, really as a reaction to the pandemic, to make health insurance, to make the marketplace more accessible for folks, especially folks that were losing their job, that weren't able to access healthcare, that obviously needed lots of healthcare. It's been extended. It's set to end this year. There's absolutely no indication by the president or the administration or Congress that there are any deals in the works right now to extend those enhanced tax credits. What does that mean? It means that we're about to see, on average, about a 75% increase in premiums across the country and about up to 55% increase in rates. And that differs by states.
Is there a way to get around that? I mean, obviously, Congress has to get back to business here and get back to work. Once they get back to work, is there a way to, without extending the credits, which I think Republicans are just simply not wanting to do, Democrats want to extend it, but we have an impasse here. Is there a middle ground?
So that's a great question. What is that middle ground? What does that middle ground look like? You know, are there opportunities to find, well, first of all, I think it's going to be really important for consumers to be really smart shoppers in this time period, right? So the open enrollment period starts on November 1st, ends on January 15th. We have a time here for consumers to really understand what plans are available, know what services that they need, right? Understand what is available. And just because a plan might offer really cheap premiums, be really conscious of the fact that those premiums might not give you or your family members the coverage that they need. So having to be just extremely savvy kind of shoppers and consumers is going to be step number one. Step number two, in terms of what Congress is doing, that's a great question. We're at an impasse, and we don't have a lot of indication right now that there's a middle ground option.
And being a smart shopper also applies to the employer-provided services, too. We got to look your thing over here and figure out, do I really need this, or do I need more of that?
Yeah, absolutely. Don't assume that just because you had certain types of coverage, that a certain physician was covered before, a certain drug was covered before, that automatically rolls over. We're not in that moment right now. You need to know what's in your plan. You need to make sure that what you need covered is covered. And you need to understand that in most cases, there are options, right? And so if you're not able to decipher that in your insurance plan, I don't blame you. They're not the easiest things to read. Please work with your benefits manager, work with your HR counselor, and there's going to be a lot of kind of public options to figure that out as well.
Before we let you go, and thank you so much for being here, it's always a pleasure speaking with you and getting this kind of information. Do you think that people are aware of this, or is this going to be a frying pan in the face kind of moment here next year?
I really don't think people are aware, especially of how this will impact employer-based health insurance, because we've heard so much about the shutdown and the shutdown being related to these ACA marketplace plans and the extension of these tax credits. I think it's an under-discussed topic that this is really going to hit employer-based plans in a real way. And the majority of us, including myself, that's how we get our health insurance. And maybe we're not even going to notice it until we see those premiums or until you show up in the doctor's office and that deductible is sky high.
Wow. Dr. Swapna Reddy, again, ASU College of Health Solutions. Good to see you. Thanks for joining us.
Thanks for having me.